We are getting conflicting reports. Is there a new variant or a new mutant out there which is affecting children, Singapore being the first example? Or are we being alarmist in this country when we suggest that there will be a third wave where children will be affected?
Thank you very much, Rajdeep, for having me. I think if you stick to facts and see what is available today, the new variant, the new mutant that we are saying, the Indian mutant, there is exceedingly small evidence to suggest that it is actually causing a lot of infection and serious infection in children. Now, forget data, but if you speak to the pediatric intensivists, I mean, are the intensive care units in India, are the pediatric care units getting filled up? Do we see that scene at all? And I don't think we do. So there is proportionately a higher number of children which will be infected. I don't disagree with that. And when we compare to the US, where you've got more and more of the adult population being vaccinated, proportionately, the younger children are going to be in the limelight because proportionately they will have higher numbers of infections. But in absolute terms, are we seeing an increase in number of cases in children? And that is the question, because the disease spectrum in children still remains largely asymptomatic or with mild cases, and the mortality is exceedingly small. And that is what the information we've got.
No, the reason I'm asking you this, Dr. Gupta, is that when you look at the United States, where clearly at the moment, 39 lakh infections since the outbreak, 14% of all infections since outbreak, but 48,915 infections from May 6 to 13, that is about 24% of all cases were of children. Brazil is the worst case, where you've got BBC suggesting 2,060 kids under 9 are dead. You've got the United Kingdom where you are, where 13% infection under 11 are leading to long COVID. So I'm trying to understand from you, are these numbers alarming, or do you believe that at the moment it is premature to suggest that COVID-19 could affect children adversely in the months ahead?
I think it is premature to consider that COVID-19 is going to suddenly explode, and suddenly in the third wave we are going to have adults, but we are going to have our pediatric intensive care units full of children. I think there is very little data to support that assertion. I think we get confused between proportions and absolute cases. I think the proportion of kids being infected with COVID-19 is high because prevalence is high, and there's no doubt about it. But how many of them are actually ending up in intensive care units, and what is the proportion of them getting so unwell that they die? The rate of death in a 30 to 40 year old in the US is about 45 times higher when compared to a child. So I think what we're looking at is still a milder burden of the disease. And my submission is this: we are at the peak of literally the peak of our number of cases. We're getting nearly 4 lakhs just a few weeks ago. Even in that peak, with that prevalence, were we seeing our pediatric care units being overwhelmed?